medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Today we're going to discuss what type of workup you should do for someone that's complaining of hair loss. Often we see so many different causes, it's difficult, but hopefully I'll be able to make it simple for you today and then summarize it into pretty much a panel that you could do. First, of course, is a complete blood count, checking for any abnormalities in the red or white blood cell count, which can indicate some sort of underlying health condition that may contribute to hair loss. We also want to look carefully at the iron studies, measures levels of iron, transferrin, etc., to discuss or look for iron deficiency because it is a common cause of hair loss. I don't think it requires any introduction, but thyroid function specifically evaluates the hormone levels by using TSH, T3, T4. Make sure they are free T3 and T4 to identify thyroid disorders that can lead to hair loss. But in addition, make sure you clearly do pretty much each time a TPO and an antithyroid globulin, as we talked about in an initial installment of this lecture series. We needed to look at specifically Hashimoto's thyroiditis, which is a common cause of hair loss. Vitamin D levels also determines if there is a deficiency, obviously, in vitamin D. And that has been significantly linked to hair loss. And pretty much, in my opinion, it should always be between 60 and 100. Levels just above 30, because many labs say that that's okay, is not acceptable to me. Look at the hormone panel. Measure the different hormones such as testosterone, total and free estrogen, DHEA, dehydroepiandrosterone. These are going to identify hormone imbalances, either too low or too high, that definitely contribute to hair loss. Folate and B12 levels should also be checked. These vitamins are also intricately involved for great hair level. And zinc levels as one of the minerals we can discuss now, because they impact hair loss, growth, and contribute to hair loss as well. If you're looking at different function studies, one of the structural studies, instead of function, I don't like that word when it comes to liver function, is a good thing to know because the enzymes and function liver disorders can affect hair health as well. And always some sort of inflammatory marker, C-reactive proteins important, or erythrocyte sedimentation rate, because chronic inflammation or infection will be related and identified through this, and they are related to hair loss. In addition, make sure in each case of unknown hair loss that an ANA is done. As you know, anti-nuclear antibody can help identify specifically what type of autoimmune disease a person has, and these can cause hair loss, such as lupus and several of the others of the pretty much 84 different types of autoimmune disease. Also get a serum ferritin. It measures the level of this protein that stores iron, particularly in the liver, and it can also suggest hair loss by being too low. Even too high may be of issue as well. And of course, zinc contributes, which we said a few minutes, to hair loss, and you should be aware of that too. Serum vitamin A, for example, too, or B12, these also are important to look at. Also, while you're looking, a lipid profile may be also important. Triglycerides or cholesterol imbalance could impact hair loss also. Now, certainly there's a few more blood tests that may be relevant and are important to look at, such as DHT, dihydrotestosterone levels. DHT is, of course, the conversion of testosterone to its more aggressive component. It is an anabolic steroid, and for certain, it can cause significant problems as well, especially when there's too much of it, and it will typically translate to androgenic alopecia. Serum copper checks for copper, obviously, deficiency. Copper in the hair can also affect pigmentation and contribute to hair loss. The vitamin A, I started to talk about high levels of vitamin A and hair loss. I've seen it once in my practice in 44 years. Someone was losing hair, had very cracked lips on the side, which we call angular chelosis. And I said, "Are you taking vitamin A?" "Yes, I'm taking something like 100,000 units a day." And the vitamin A level revealed that issue. Serum selenium, many states, their food supply is low in selenium, depending where you are in the country, but it is an essential mineral that plays a role in hair health. Magnesium, simultaneously for magnesium deficiency, because that can also impact hair loss, and calcium, which you will know too, also can create hair health issues. Albumin is another. It is the number one protein, as you know. It does help to assess, in general, someone's nutritional status, and it can give you enough information to be able to determine what else may be causing the issue. Let's summarize this for a moment. If you wanted a panel and you write this down, it will be a very good panel to determine what's going on. So a CBC, a complete metabolic profile, magnesium level, a SED rate, a zinc level, B12 and folate level, a vitamin D, 25-OH, an anti-nuclear antibody, serum DHT, dihydroxytestosterone level, a copper level, and if you want, you can always add on selenium or vitamin A if you think it's necessary. With this in hand, at least you have a good blood test workup that will send you in the correct direction in trying to figure out what else is going on. Of course, a good history and physical exam is going to be invaluable, knowing whether they've been chemically exposed or, for example, they're using things on their hair, or they're using mechanical things like heat, blow dryers, things like this necessary, straighteners, dyes. All of these can contribute to hair loss, and of course, medications like chemotherapy and others can do similarly, which you're already, I'm sure, aware of. So check all this out. Look in the scalp. Make sure you don't see any type of fungal infection or any other types of infection or scabs or things like this that may relate to the hair loss. In part 3, I'm going to delve into some of the treatments and some of the natural treatments, some of the things that really I have found to be so helpful, and hopefully they'll be helpful for you as well. Thank you so much for watching. I'm Dr. Mitch Ghen.